Implementing an adult congenital cardiac program. My name is Virginia Travieso. I have been a cardiology nurse for over 30 years and have been in the leadership role for over 12 years. Today I'm going to bring to you my strategic plan in implementing an adult congenital cardiac program to the Methodist Hospital system in San Antonio. Congenital heart disease is the most common type of birth defect. Due to common advances in treating infants and children with congenital cardiac abnormalities, we now face a new challenge in taking care of the growing number of cases of adult congenital heart disease. 49% of individuals with severe congenital heart disease are adults, according to the American College of Cardiology. The number of adults 65 and older with ACHD is also rising, with admission rates increasing by 30% for this group of patients over the past 10 years. Traditionally trained cardiologists typically shy away from this patient population due to the subspecialized care that is required for these patients. Adults with congenital heart disease require care that cannot be delivered by adult or pediatric cardiologists alone, but instead require the need of a multidisciplinary staff of adult and pediatric cardiologists, cardiac surgeons, electrophysiologists led by a fellowship-trained adult congenital cardiologist is also needed. Here I have displayed the SWOT analysis for the adult congenital cardiac program. One of the strengths would be the increased market growth for the Methodist healthcare system. Another opportunity would be the increase in demand to provide other pediatric services that support advances structural heart procedures. A weakness would be the financial impact. There is no existing adult congenital programs in Texas to benchmark from. High cost in developing an adult congenital heart disease program with no financial support granted would also be a threat. To develop a full spectrum of adult congenital cardiac program that will service all South and Central Texas, I have outlined the financial performance goals, the customer service goals, the internal business process goals, and the learning and growth goals as well. Methodist Hospital leads the region in pediatric congenital heart with comprehensive services for pediatric cardiology, pediatric electrophysiology, and pediatric cardiac surgery, all supporting a well-established pediatric heart program. Today, due to medication and technology innovations, pediatric congenital heart patients are reaching adulthood, and there is an increasing demand for services related to advanced structural heart procedure, heart transplants, and maternal fetal care, adding to the return on investment for this program. There are no adult congenital cardiac programs in South or Central Texas currently, which presents an opportunity to assume the care of the existing and growing patient population of adult congenital heart patients. An estimated 7,000 congenital heart disease patients are presently living in the Methodist primary service region who are likely receiving no care. Additionally, there are 2 pediatric cardiologists in San Antonio, Texas, who have cared for this population of more than 300 patients for over 20 years, who will soon retire from their practice. It is important the recruitment of well-renowned and experienced pediatric adult congenital disease cardiologists be achieved. A well-planned marketing strategy will allow double the numbers of admissions and procedures given Methodist Hospital's dual adult pediatric congenital footprint in San Antonio, Texas. Establishing an adult congenital program will allow Methodist Hospital to align with existing regional referral locations, especially in the South and Central Texas region, where it is mostly needed. The employment of an adult congenital cardiologist in the San Antonio market allows Methodist Hospital to establish an adult congenital cardiac program and create a full spectrum of care from pediatric congenital heart to adult congenital heart. This now concludes my presentation. Thank you.